What's up, everybody? Welcome to the Average African Kid podcast. It's your host, Toya Risanara, a medical student, 500 level medical student, which will change soon. But I have some questions for those coming into the clinical wing, and I thought I should just answer it all at once. How do you think about that? So it's just me answering all the questions at once so that I don't have to do it multiple times. So the first question that I'll be addressing is how was N1 posting? In other words, the question is, how was your very first posting in clinicals? And let me break it down very simply. We got into the clinical wing in January. We got there, and the first weekend we set up in our hostels, and then Sunday service was nice. I went to KCF, King's Court Fellowship, now Booth Fellowship, and I was ready for the next day. So you have to get some books. So you pay cash and you get like all these manuals that you'll be using. Like they're your logbooks where you'll be signing for different procedures, different classes you attend, different lectures. Whatever you do, you have to sign. Each posting has its own logbook. So you get those books to start with, and then you have a 1 week introduction. In that 1 week introduction, it was just like telling us about stuff in medicine. Honestly, that 1 week introduction was not that helpful, and that last video when doctors talked about it was, yeah, it's actually true. That introduction was not that good, although yours might change because they might do your introduction with other programs like physiotherapy and the other guys. So for me, that 1 week introduction was just them trying to ease us into the system, and for me, it was me just trying to meet my friends and have some fun before all the hard work started. And my birthday fell before the work started, so I had my birthday before we started heavy work on 22nd of January. So it was very good for me to just chill before the classes started. Then the next week after that was 1 week of introduction to medicine. So then we had different doctors, different residents, I think we had a health officer come, but most of them were residents. Let me just give you the hierarchy of things now so you understand how it works. So the hierarchy is this: medical students were the baseline. Then final year medical students, they're also on the baseline, but they're a bit higher up because they are doctors just yet, they don't have their certificates yet, the final year medical students in your classes, in your school. So they should have all the necessary training. They're just getting better at what they do. And after the doctors, the student doctors become the house officers. Then the house officers are doctors who have graduated, but they have to do 1 year of training anywhere they want, any licensed hospital that can accept house officers, and then they spend 1 year there. And in that training, they're doing all the hard work. So most of the time, in your posting, the people that you interact with most are the house officers, because they'll be the ones running the hospital, running the clinic and everything, and you'll be working with them. So after the house officers, we get the medical officers. Medical officers are those who have passed through house officer work, and they are serving, they're doing the NYSC. So you do NYSC for 1 year after you do your house officers. And also, after you get your house officer work, your 1 year, you are licensed. When you finish medical school, you get a temporary license. And when you finish your house officer placement, you get a permanent license, which you have to renew. I think it's every year or something. But it's only after your house officer you become a permanent licensed doctor. So after that, you do your medical officer. That's NYSC, 1 year. And then after that, if you decide you don't want to go into any other training and you just want to go and do other things, go into crypto or even just practice from hospital to hospital, you're a medical officer. You are there, you are completely medical officer till the end of time. But if you want to go further, let's say you go to a teaching hospital and you want to go and specialize in surgery, in radiology, in ophthalmology or something, something distinct. If you want to specialize in that thing, even cardiology, endocrinology, nephrology, you go into residency. Now residency, there are levels. There are the junior residents, of course, the newer residents, and there are the senior residents. They also call them registrars. SR, senior resident, senior registrar. So these are residents. These are people still in training, but they are above everybody else in the system. You see them mostly. They're the ones running most of the things because they are a lot more residents than they are consultants, which is the next level. A consultant has finished all the residencies and has done the necessary exams, so now they are the apex of their field. The consultant in cardiology, consultant in family medicine. You have to do a lot of research papers to be a consultant and a lot of other things. So after you become a consultant, the other side attractions, like you can go into like becoming the CMD of the hospital, the chief medical director. Or the CMAC, the chairman of the medical advisory committee. These are all positions that you will meet them when you get to school, but they are all hierarchical positions, not the academic positions. So after the consultants, you become a professor. A professor is like the highest point. A professor has gone through all the other steps and it's like very vast, and they pay them very well because they have some expertise that nobody else has. So they might not be doing all the work anymore. They might just be teaching and training. So when you're with your professor, they'll be teaching you a lot, and then you listen a lot because they have a lot of insights. And you're also a bit. They're also nicer actually here for us at Booth. Consultants, professors are nicer. Okay, let me change that. They're all nice. They're all nice. What I mean is that they are more chill. They might stroke you depending on who they are, but they are passed through it all so often. I've seen so many of you that you really don't mean the world if you make a mistake. They just overlook it sometimes and then they teach you well. Other times they stroke you and then they teach you well. But they have seen so many students that you are not the best they will see. You are not the worst they have seen. So don't stress too much. But if you're saying nonsense, they will catch you. So work hard. So with the hierarchy out of the way, when you get into the medicine posting, it's going to be split. Depends on how they're doing it. You have medicine and you have surgery, right? But the way both runs the program right now is that you will be doing your medicine and surgery posting at the same time. You have 8 weeks to run that simultaneously. You go do another posting and you come back for another 8 weeks. So medicine and surgery, they are the first postings that you do not complete. In other words, the first exam you end up doing in both is not even medicine and surgery. It's going to probably be pathology and pharmacology. Because after you do your 8 weeks, you go and do path and pharm, and you come back to medicine surgery. That kind of crazy thing, except your flowchart is a bit different. If it is, you can send me a comment. But how it works is that you spend 1 week doing medicine classes, like the whole week you're taking classes in medicine. The second week, all of you together are taking classes in surgery. The third week, all of you are taking classes in medicine. The fourth week, all of you are taking classes in surgery. So you keep alternating like that. But think about it like this. All those classes, they only happen in the morning. I think it's from like 8 till like 11. You know the exact time. So the classes are early in the morning and in the afternoon from 2 to 4, something like that. So you have a block in the morning for classes and a block in the evening for classes. In between that block is clinical exposure. So what that is that you have to go to the hospitals. If you're in medicine, you go to either the clinic. A clinic is a place where many people come to see doctors in an office, right? It's different from a theater where people are booked for surgery. It's different from the accident and emergency where people rush in for accidents and when they have emergencies to see a doctor or the medical team there. So a clinic is like your office where you come and sit down. I don't like clinics. Some people like clinics, some people don't. But in a clinic, the doctor, who could be the house officer if the whole place is packed. It could be the resident, junior or senior. It could be the consultant. It could be the professor. Depends on the day and depends on the schedule. Because each day, if you're in clinic, Monday to Friday, has a different emphasis. Like, for example, Tuesday is cardiology clinic, Tuesday is endocrinology, Monday is something else, Wednesday is nephrology, something like that. Thursday is family. That's where cardiology really comes on Thursday, although it's not supposed to be. Then Friday again, you have the HIV clinic, which you don't do yet, and it's spread out. I had the breakdown, but maybe I'll get that to you later when I can actually remember where I kept it. But you'll learn that. So with that breakdown, you have your different postings. Oh, and there's ward rounds. So in the ward rounds, you are with the doctors. So let me break it down to you like this. You're either going to be in clinic, in medicine, you're going to be in ward rounds, or you're going to be in procedures. So now, when you have these three things that you're going to be doing, it's going to be rotated. So 1 week you are here, next week you're doing the next thing, next you're doing the next thing. So clinic ward round procedures. Procedures are like you'll be in the A&E, accident and emergency, trying to get as many procedures. They'll teach you how to set lines. The doctors will teach you how to set lines. You draw blood. You will take urine samples. You insert catheters. When you get good, you learn all the procedures about it. You might do a suture if you get not too many. Depends. In ward rounds, you are standing from 8 a.m. to like maybe 1 p.m., 8, 9, 10, 11, 12, 1. Depends on how many patients and how much the professor consultant wants to teach, because you usually do ward rounds with the consultant. Because the idea of a ward round is that the house officers have been managing the patients for the past few days, and now the consultant is going to check to see how far the management has come and to see any complications and to make any recommendations. So like a specialist care. And each day is a different consultant from different block. Cardiologists come, nephrologists come, just different for each day. You know the schedule when you get there, who's around. Clinic is, like I told you before, you just sit down, the doctor is here, he'll be seeing his patients here, and all of you just sit down around the wall and sometimes he or she breaks her teachings, her seeing the patients and start asking you questions. That's the percussing. So they ask you, okay, what are the cardinal signs of inflammation? What is the normal value for sodium? 135 to 145, that kind of stuff. Is he actually check it? So when you are going through all those kind of things, what's the value for calcium? How do you know is 3.5 to 5.0? That kind of stuff. Potassium 95 to 104, something like that. They'll ask you all these questions. Depends on the clinic you are, and you should be reading so you have an idea of what you're talking about. In medicine, they love Hutchinson's. Prof loves Hutchinson's. It's a book on the practice of medicine. It teaches you how to practice and how to think like a doctor. So it's a good thing to get that book. Some people like Fallacious, another bigger book. But even if you don't get the physical copy, get the digital copy. But I didn't get the physical copy, but I use my friend's physical copies. So it's a very good book to own. Either way, digital or physical, you should have that book. So I've given you the framework of what medicine and surgery first posting is like. Now, okay, that's medicine. Surgery, you are broken down into 4. General surgery, orthopedic surgery, pediatric surgery, urology. Yeah, either of the 4. So they'll split you in that 4. And I'll tell you how they separate medicine and surgery, right? They divide the class into half. The top half of the class by matric numbers will go to either medicine or surgery. The other half will be the second, first. And you'll be in those clinical rotations. Like I told you that every week you switch, right? But that's for classes. But for the first 8 weeks, you are just going to be doing either medicine or surgery. The second 8 weeks, you do the opposite. Let me know if this makes any sense or if you're still having issues with clarifications. So in surgery, you have those 4 postings and you go there. Surgery, you're standing a lot. You're also going to be going for surgeries actually. So you need your scrubs, you need your crocs, your crocs that have been washed. I don't call them sterile crocs because they're not really sterile, but they should be crocs that you do not use for anything else but surgery. As likewise, the scrubs you use for surgery should not be the scrubs you wear around, because people wear scrubs around to increase the sterility of the procedures. You want to have a separate scrubs for surgery. Although people don't do that, what some people end up doing is that they wear their word coats on top of their scrubs if they're using it around, and then they go for the surgery, they take off the word coats and use it here, so that this is kind of sterile. But yeah, that's what you should do. So you go through all these four areas. Depends on how they want to do it. Every week, every 2 weeks, you switch. The big thing about all is clerking. I will make another video about how to clerk. The honest truth is that I'm still learning how to clerk, and what you will see is that there's no one that has actually achieved perfection in clerking yet. Okay, there might be people, but I'm not one of those people. And with the learning how to clerking is just asking your patients a series of questions from the top to the bottom, so you can sequentially get an understanding of the patient's condition. So there's a very established gridlock on how you should clerk. There's a step you should follow. For example, you collect their biodata first. They use NasoRAM or NasoMats. I'll talk about all these things in another video. So after you get through the biodata, you can now talk about history of presenting complaint. Why did they come to the hospital? You can now break it down into the cause, concerns. Another video for clerking. So, but the idea of clerking is that you have these gigantic notes, higher education notes, can be hardback, where you go maybe the day before the ward rounds in medicine, or 2 days before. You go and collect the patients. Your group leader splits you up. You and your teammate go and collect the patients, either in Yoruba or in English. Even if you don't speak Yoruba like I don't, you learn a bit of Yoruba and you go with someone who speaks Yoruba so you can learn and write whatever they are saying. So don't be too frustrated. I've been very frustrated with it myself, but if you don't speak Yoruba, you need some help. I can show you how to not be frustrated, but then I can now give you some tips on how you can start learning, because I've started learning and I'm grateful for those who are teaching me and the way they're teaching me. So that's how you go with them and you get all the information from the patient. You ask them about their family, you ask them about how their diet, any allergies, you ask them about when it started, the timing, the onset, the radiation, the character. There's so many questions and so many sequences that you will forget initially. And then after you have done all that, initially they will not stress you, but later on they will ask you to do examinations. Examinations too, you'll be taught, but we will also teach you. I can assure you that we will do our best to make sure you guys are very, very grounded in your clerkings. We can show you our own clerkings that we did and how they look, so you can get an idea before you even come. Just send me a message in that regard if you want to see those clerkings. So by doing that, by going in that sequence, you get everything, and then in the ward rounds, you present it to your consultants, and they'll tell you, okay, why didn't you ask this? Or at the end of the video, they ask you, what are you thinking? What condition are you thinking this patient has based on this signs? Patient has a lot of urine, that's polyuria. Although when you're writing the patient's, when you say patient is peeing a lot. But when you are talking to medical people, not about what the patient said, when you're not describing what you understand, you not say polyuria. Don't say the patient complains of polyuria. The patient cannot complain of polyuria. The patient doesn't know what polyuria is except they are medical. So your patient has polyuria, polydipsia, that's very thirsty, drinks a lot, and polyphagia. Okay, so we're back again. And the overview of medicine is that you are going to be learning a lot. Every ward round, every clinic, everything you do, you're going to be, so you should have a notebook where you write things that you're going to learn. You don't just write everything, just the key things that you're going to go back and read. Before every clinic day, before every ward round, you should be reading things about that clinic or ward round. Ultimately, it's going to be exciting, it's going to be overwhelming, and you're going to learn a lot. So just realize that you're not the only one who's struggling. Everybody else is probably lost, except the appearance of doctors or had previous clinical exposure. And trust me, even if they had all this exposure in like 3-4 weeks, you catch up. So when people are already flowing in the first few minutes and you are lost, don't worry about it. Just need to ready to gain your ground and talk to somebody. Don't just be quiet and get that imposter syndrome that, oh my gosh, I'm left behind. No. Okay, my camera just died, so I thought I'll just end the video here. So the summary of the medicine, introduction to medicine, is that medicine is going to be fun. You're going to enjoy yourself. When you have questions, please reach out to us, your guys above you, directly above you. Anybody is going to be loving and willing to help you. So please reach out, we can help. Just prepare yourself. I'll be working on a video where I talk about the things that are essential in medical school, like what you should buy, what you shouldn't buy. If you really want to see that video, send me a message, try and hurry it up. And yeah, so enjoy the rest of your break and know that when you're coming for work, but also a new environment. So yeah, that'll be nice. Stay blessed, stay safe, stay amazing, and see you soon.